Hi everyone. So today I'm going to go over the terms and important issues for Chapter 7, which is sexuality and sexualization. So sexual scripts are descriptions of behaviors that reflect beliefs about what normal sexual behavior is in a given culture. These comes from watching other people, so their behavior, but also the media's portrayal of sexuality, sexualization, and these scripts convey assumptions about what actually counts as sex, like what is sex? Is it oral sex? Is it only penetrative sex? How to act during a sexual encounter, who can be seen as sexual, and when one can engage in sexual activity. So do you wait for marriage or do you do it in a hookup? Compulsory heterosexuality is really a script. It's an idea that the only appropriate or normal romantic and sexual behaviors are heterosexual. So that's seen as the default, and everything else is other. We have this alphabet soup of LGBTQ plus, we say now. Learning to prioritize heterosexuality is a key part of gender role socialization. So part of what girls and women learn is to do things to get men's attention, which can be problematic in and of itself. So performative bisexuality is a sexual script in which heterosexual women engage in sexual activities or make out with each other. So it's women who are straight making out with other women who are straight for the enjoyment of men who watch them. So your book gives the example of the infamous Britney, Madonna, Christina kiss at the VMAs. There was a great piece published maybe about 10, 12 years ago in Psychology of Women Quarterly that talked about how college women sometimes do this at parties in a performative way for men. So the idea behind sex in our culture scripts are that men want it and initiate it, and women should be sort of the gatekeepers and keep men out. So there's the sexual double standard that women are judged much more harshly than men for engaging in the same or very comparable sexual behaviors. Slut shaming is part of that, and that's the criticism of girls and women for their actual or presumed engagement in sexual behaviors. So sometimes this will happen just because of rumors, not because the woman has actually done anything. Sexual socialization is the process of learning about sexuality and the act of sex itself. So parents are often uncomfortable talking with their kids about sex. So instead, other things fill it in. Broader social networks, especially peers, will fill in the gaps. The media becomes a primary source of information about sexuality, which can be problematic because of the compulsory heterosexuality and the lack of focus on women's pleasure. Safe, and I like how your book does this, it's a safer sex, is sex involving contraceptive, and typically we think of condoms in this way, right, to minimize the risk of sexually transmitted infections and pregnancy. There are different types of school-based sex education, and this might be a great thing to talk about either in your blog or the discussion board this week is, what was your school-based sex education like? And what did you learn? And what do you wish you would have learned? So abstinence-only sex ed is typically what we hear the most about in America. So it just says the best way to prevent anything is to abstain from marriage. Okay, technically correct, right? But we know that A, not all people really believe this, and B, the areas that have abstinence-only sex education actually have the highest rates of STIs and teen pregnancies, mostly because they never learn about contraceptives. So not necessarily doing its job. Abstinence Plus promotes abstinence, but also includes other information about contraception and safe sex. And then comprehensive sex ed just includes abstinence in a large list of contraceptives, essentially. And it focuses on communication and interpersonal skills and training. So how do you talk with someone about sex. And then sex positivity is sort of like a subset of comprehensive sex ed. So sex positive sex ed sees sex as a healthy and positive aspect of life. And therefore, like, it's a good thing we should talk about, not just like a thing we should try to scare people away from. All right, so these diagrams in your book are so important. And whenever I teach a women's and gender studies related class like this one, I typically put up pictures like this because very few people, men, women, any non-binary identified individuals, have seen diagrams like this, unfortunately. So typically when we do sex ed, we see the interior diagram of the women's anatomy. So the uterus, the fallopian tubes, the ovaries. But this is the one on your left is the outside, the vulva, and then the one on your right is actually a diagram of the clitoris. So we'll get to that in a minute. Okay, so what do we have here? So we do have the clitoris, and I'm not sure whether you can see my mouse or not, but at the top we have the clitoris, and that is a small bud. Its primary function is pleasure. Okay, and in fact, what we'll see when we get to the second diagram is it's not just what we can see out here, which is really cool. Then you have the urethra after that. That's where women urinate from. And then you have the vaginal opening after that. This is where we have sex, and at least vaginal penetrative sex. And this is also where babies exit when they're born. Some of them, sometimes they come out through C-section. And then back here we have the anus, and this is where we excrete feces. So yes, women have 3 holes. Some people don't know that. And then there are also these 2 layers of labia. On the outside is the labia majora, on the inside is the labia minora. Okay, so this whole area is called the vulva. And typically in our culture, it's just referred to as the vagina, but the vagina is actually what's inside the vaginal opening. This whole area is actually the vulva. So again, if we're using accuracy. Now, as I mentioned, the clitoris looks like this teeny tiny little bud externally. The really cool thing is that it's so much more than that. And in fact, I believe this was really only discovered in the 90s, which is sort of mind-blowing, right? So this is what we see outside the body, the clitoris glands, okay? And there's a hood that covers it, much like an uncircumcised penis. Okay, but then there's a shaft that goes back, and then you can see there's all these other parts of it. So there are these sort of wings called the clitora crura. There's the vestibular bulbs that are also part of it. And here you can see how the labia maps onto that, where the urethra and the vaginal openings are. So some people have argued that the G-spot is actually just related to where the clitoris interacts with the vaginal wall. So in fact, any orgasm in a woman may in fact be a clitoral orgasm, even those we used to think were just vaginal orgasms. So yeah, we think of the clitoris as this little tiny thing, but in fact it's this very complex interior system, which again, really important to know about. This is a list of all of the types of contraceptives that are available and their relative effectiveness. So abstinence, again, yeah, that's the way you can best prevent disease or an unintended pregnancy. But outer course is another option. Some people just call this dry humping. And then you get to things that are actually pretty effective. Any form of hormonal birth control tends to be really good. So things like pills, the patch, the vaginal ring, shots, and then the birth control implant, which is typically in your arm. Those tend to work really, really well if you use them as prescribed. Now, if you're using them not quite as well, maybe you're skipping a day when you're taking your pills, then you see the typical use that they are less effective. IUDs, intrauterine devices, are actually probably the most effective because it takes the sort of user error out of our hands. These are inserted vaginally, and then they sort of live in the uterus. Some of them have hormones, some of them don't, and very effective and long-term. So some of them last up to 7 years, for example. Male condoms are what we, again, stereotypically think of when we're thinking of disease prevention. And they are pretty good with perfect use, as you can see, with typical use, where maybe drugs, alcohol come into play, you're not quite getting it on right, not as effective. And then there are female condoms, which are inserted interiorly, but essentially do the same function as male condoms, less effective. Spermicides are another thing that you can use. Diaphragms are sort of old school, but some people do still use them. Same with sponges. And then fertility awareness, this is the rhythm method where you keep track of your cycles, and then if you're trying to prevent pregnancy, you just don't have sex on the days you would be ovulating. It depends on the method, how good it is. But with typical use, it's not very good. You see about 1 in 4 women get pregnant doing it. Sterilization, so when either the man or the woman has surgery like a vasectomy or a tubal ligation, that's very effective. And then the pull-out or withdrawal method, people think that's pretty effective, but again, you can see with typical use, we're getting close to 1 out of 4 women getting pregnant with it, right? And then with no contraception, it's way up there. So anything on this list is better than nothing, but clearly there are smarter choices to make in some cases. Now, the really interesting thing is that people tend to think that everyone is having lots of sex, right? And lots of casual sex, which is sex outside of a committed relationship. Everyone's hooking up. This is sexual activity between 2 people with no expectation of commitment, but people disagree. Is hooking up just making out? Is hooking out anything beyond oral sex? Is hooking up only penetrative sex? Again, fuzzy definitions. But generally, most people think everybody else is having more sex than they are. And so this is termed pluralistic ignorance. And it occurs when people mistakenly think their own attitudes or behaviors are different from others, when in fact, we tend to be fairly similar to each other. Now, enjoying sex. Masturbation is stimulating yourself sexually, usually through touching your genitals to result in sexual pleasure. Women report lower rates of orgasm in men in general with sexual behavior, although they report more with masturbation than they do penetrative sex typically. And women in general report being less satisfied in their sexual encounters than men are. And part of that may be linked to these sexual dysfunctions, which are listed in the DSM, the Diagnostic and Statistical Manual of Mental Disorders. There's problematic things here, right? Your book talks about this. The fact that about 40% of women sampled could meet criteria for one of these, or at least are reporting some sexual dysfunction, indicates that there's probably something going on that isn't entirely on the woman, right? Sort of leave it there. Think about our sexual script and how it focuses on male pleasure, not female, how penetrative sex may not be as enjoyable for women. Okay, so there's hypoactive sexual desire disorder, where you just don't have an interest in sexual activity or you don't have any sexual desire. Sexual arousal disorder occurs when you have desire to have sex, but you have difficulty getting aroused or staying aroused. Maybe it can be related to physiological things like difficulties getting lubricated vaginally. And then female orgasmic disorder is where you just might not orgasm, or there's a delay or decreased intensity of orgasm. And then you can also have painful intercourse as well, although that is typically tied to a physiological condition. Although certainly the psychological component can come into play, right? So again, these are labels that genuinely reflect things that people do experience. However, I think they're also labels we tend to throw at women when they're reporting not having, let's say, desire or orgasms, without fully investigating whether their partner or partners are engaging in things that they actually enjoy. All right, so some of the stuff we talked about last module with body image issues come into play here as well. So body image self-consciousness is where you're surveilling your body, engaging in that self-surveillance that's part of objectification during sex, due to concerns about how you look to your sexual partner. Cognitive distraction, So it's shifting focus from how you feel about what you're experiencing to worrying about what your partner's thinking about. So it's hard to enjoy the moment if you're spending the whole time in body image self-consciousness, right? Spectatoring, sorry, is an out-of-body experience where you focus on things other than the sexual encounter. So these are all related. And the spectatoring especially relates to the work of Masters and Johnson, who talked about performance anxiety in the spectator role, and how difficult it is to enjoy things when you're sort of seeing it from outside yourself. Objectification by and towards romantic partners is also related to lowered relationship satisfaction. Now, sexualization is related to objectification, but sexualization is a little more specific. So it's the imposition of sexuality on others, considering of people as sex objects, and valuing people merely for their sexual appeal or sexual behavior. So here we're turning them into an object specifically related to sex. It's very prevalent throughout the media, and one of the things that always surprises people is that we're taught that sex sells, and that's why we see it a lot in advertisements, but in fact years of research actually show it doesn't, that people might pay attention to ads that have sexual content, but in fact they're much less likely to remember what product was being advertised, much less actually go out and buy it. Now, in terms of sex work, this is an umbrella term that refers to the exchange of sexual services, performances, or products for compensation. So this can be prostitution, but it can also be something like exotic dancing. It's disproportionately for men's entertainment, essentially. Some women do choose to engage in sex work and find it empowering, but for others, it's a choice they have to make because they don't have any other options, or it's the highest paying option. Because it's illegal in a lot of municipalities, this means it's a very dangerous industry. So if you are attacked, for example, it can be really difficult for you to call and report. This is really different in places where it is legal. So for example, in Amsterdam, each sex worker actually has a call button in their room, and the police report time, if they hit that call button for help, is less than 60 seconds. Self-sexualization is purposely engaging in behaviors or practices associated with sexualization. So maybe you wear a push-up bra, or it can go more extreme, like Girls Gone Wild type stuff. And there's a debate about, is this informed choices, or are you being taught this is the only way you can be sexual by the media? And is it empowering, or is it in fact something that ties, again, to objectification and all of its consequences? So sexual agency is being comfortable with and in control of one's own sexuality. And so I think a lot of people think that's what self-sexualization is, and it can be related, but it's a distinct construct from sexual agency. And sexual agency is the one associated with positive outcomes. So sexual assertiveness is the ability to ask for what you want and refuse what you don't want within a sexual encounter. All right, so that is, again, a thumbnail sketch of everything. I look forward to seeing what you all talk about in the discussion section.